conversation, Dr. Oz, you just had with one of the leading epidemiologists in Europe, Dr. Didier Raoult, and a small test group that he convened. 6 people ultimately dropped out for whatever reason, but a small test group of individuals treated with that old anti-malarial and azithromycin. Let's watch.
If you personally had coronavirus, the COVID-19 virus, would you treat yourself with this combination therapy?
Of course. I've never did to my patients some things that I will have done for myself. Never.
Yeah, Dr. Oz, there are so many people out there, including on some of our cable competitors, who are rushing to the camera saying, well, you can't do this because it's not approved by the FDA. What would your response be to that?
Well, I was intrigued by this physician, Dr. Raoult, who's actually world famous. He's well-respected within France. The other French centers, some of them are copying his protocol. And he acknowledges it was a pilot study. But as an infectious disease specialist, he argues if I got rid of all the virus in patients who were treated on this protocol within 6 days, all the virus gone from their noses, that means they're not infectious anymore. So that's a good thing. And if I reduce significantly the amount of virus they have throughout the course of treatment, that's a good thing. He shared with me that the clinical outcomes were looking okay, but he didn't want to share that publicly because he hasn't gotten enough data. The question is, are we going to do clinical trials? And the answer, Laura, is yes, we have to do them. As a physician, I'm proud of our American tradition. We've got to do the randomized trials, the big trials that the FDA wants. The question isn't that. And by the way, I'm helping to fund the one at Columbia. Well, there are others at Cleveland Clinic. There's some great programs they're already starting on this process. We'll get that done, but it takes a while. And in the meantime, what are we going to do for the many doctors who want to treat their patients, because these are prescription drugs, who feel their patients might benefit from this, and there are plenty who have reached out. And I would argue we can do both. Do the clinical trials, be sure we're doing the right thing, but make sure if clinicians want to use a drug that is FDA approved, in this case both are, off-label for an indication where there's some evidence, and it's not just this French doctor, it's also in China where there was some evidence of success, that we should allow that, again, tracking all the information, learning what's being done, but allow that. Otherwise, people are going to do it anyway behind our back.
Yeah, and off-label use is done in everything from late-stage cancer to other illnesses, as long as the drug is approved and the side effects are monitored, especially with cardiac implications. That's fascinating. Well, here's what an MSNBC guest today said about this particular drug combo. Watch.
Do our public officials want to just kind of go wild with this and give people untested medications? I personally would not like to be the recipient of something that has not at least been tested for safety. I think that's true for the majority of our medical community. We're desperate, yes, for treatment, but we don't want our desperation to lead us down something that might not be a good idea.
Dr. Oz, are you concerned about the safety of these medications?
Well, the malaria drug that you mentioned earlier has been used for 65, 70 years. And, of course, every drug has potential side effects. In this case, it's a cardiac arrhythmia complication, but that's often screened for anyway. And it seems to be managed in the case of both France and in China. They did not have significant complications, albeit they were very small trials. But, again, the drug's been used for decades without issues. Z-Pak is an antibiotic that people use quite frequently, not panicking about side effects. Are there going to be complications if you give it to 100 million Americans? Of course. And I want the clinical data. Please let me be clear on my support of Dr. Fauci and all the appropriate desire that the FDA and others have to study these drugs. It would be fantastic to prove beyond a shadow of a doubt that they work. But what are we going to do in the meantime? What's that strategy?
Well, Dr. Oz, I've had a chance to talk to a number of treating physicians, both here and in Europe, over the last 4 or 5 days since I initially mentioned this a week ago. And basically, a lot of them are saying, and tell me if you agree, that these drugs are good for a number of reasons because they reduce the need for the number of ventilators that are needed. So a lot of people come in with middle of the road or even serious symptoms, then don't need the vents that are in short supply. And that is also a benefit in addition to, obviously, the health and well-being of the patient.
Well, that's one potential benefit. Again, we haven't proven that. But what I do think is, based on just the little bits of data that we have, if we do these clinical trials, I would anticipate a reduction in complications. In part, the French physician, Dr. Reynolds, pointed out that, and they get ultra-fast CT scans on their chests of all their patients, that a third to a half of all the patients have little lung lesions, little marks in their lungs. And he believes those will be well treated by the combination of the antimalarial drug and the antibiotic. He also pointed out that if you reduce the infectiousness to 6 days rather than the 20 days that the Chinese were experiencing, that's 1/3 the infectivity. That's going to dramatically change how the virus behaves. That means maybe we won't have to do social distancing for quite as long if we can control the virus better.
And tests for antibodies, everyone's talking about that. Some people just don't get the disease even if they're exposed to it. Dr. Oz, thank you so much. Loved your interview with the professor, and that was cool to see. Thanks so much. Talk to you soon.
Good luck, Laura.